Good afternoon, all of you. This is Dr. Ruchi Shirudkar. I am a director and a founder of an organization which is called as Pediatreat. In this forum, we are discussing various cases and various remedies and in detail and how we see these remedies in children when they come to our clinic. So today the remedy that we are going to discuss is tuberculinum. Tuberculinum is very, very commonly seen in our practice. We very oftenly I have prescribed tuberculinum and it does wonders. So whatever children, when they come to your clinic, you can divide them in two types of children. One is the mild, quiet, yielding type, and the other ones are naughty type, जो आपके clinic में आके हर चीज को हाथ लगा रहे हैं. Mama, parents complain that they are very naughty and they are very mischievous or they trouble the parents. So basically आप दो पार्ट में डिवाइड कर सकते हैं अपनी प्रैक्टिस पीडियाट्रिक को. So today I'm going to talk about till now we have discussed calcarea carb and pulsatilla and causticum and drugs like that, Baraita carb. So from today I'm going to discuss the naughty lot in homeopathy. So the first drug which is commonly used is tuberculinum. So today I'm going to talk about tuberculinum. I have used it so many times and it has worked wonders in pediatrics as well as in adults. तो tuberculinum बच्चा naughty है, mischievous है, destructive है, disobedient है, obstinate है. So imagine सामान तोड़ता फोड़ता है, कहना नहीं मानता है पेरेंट्स से कि एक जगह पे नहीं बैठता है. I am telling this version why? Because they will not say I am destructive. What version that the patient complain is, you have to understand and convert into rubrics, right? So the parents would say बहुत जिद्दी है, कहना नहीं मानता है, एक जगह बैठता नहीं है. This is a very, very characteristic. बहुत internal restlessness होती है. Even adults, they will never be at one place. So they are wandering in your clinic, touching various things. It is very close to tarantula, veratrum, but then we will differentiate it later. So there is a lot of internal restlessness in tuberculinum. They will not sit at one place. They want to see everything. They want to play. Tuberculinum में इतना restlessness होता है. This is a tip that I'm giving you that I always ask when I want to differentiate between remedies is, बच्चा एक toy से बैठ के खेलता है क्या? And the parents usually say no of tuberculinum. Restlessness children moves from one toy to another. They cannot play with one toy. Lachesis maybe sit aversion to sit है, hyperactivity है, but lachesis का बच्चा delusion charmed and cannot break the spell में है. तो lachesis का बच्चा अगर कोई टॉय उसको इंटरेस्ट दे गया या किसी टॉय में उसको मजा आने लगा तो lachesis का बच्चा उस टॉय से काफी देर खेल सकता है. But tuberculinum never ever. Tuberculinum is very restless, very hyperactive. Destructiveness is the core of tuberculinum. Tuberculinum wants constant change. There is a rubric as change desire for constant, change desire for. They like to travel, they like to wander. So if you see, वो ये movie थी ना, ये जवानी है दीवानी, उसमें जो रणबीर कपूर का रोल था, that is tuberculinum. He was very discontented with everything outside, though he had everything, and he wanted to travel and he wanted to explore the world. So that is tuberculinum. And tuberculinum, even in their jobs, if I talk of adults, they want to change the job. If the job is of a type that is giving that excitement and change, they will stick to that job. For example, travelers या जो tourist होते हैं जो about different places के लिए बताते हैं, then they will probably stay in that job. But if it's a monotonous IT job, they get really bored and they want to explore the world, and so they keep changing. Coming back to pediatrics, one more tip that I would give you for tuberculinum children is there is a rubrics valuables. Valuable matlab, for example, this headphone is very valuable to me and my daughter realizes or my son realizes, this is a very prized possession. तो वो जानबूझ के उसको तोड़ देता है. Intentional, this thing is intentional. So they will try to break things which are your prized possession, or probably a lamp that you really like, or it is not galti se ki khelte khelte toot gaya. So parents say ki जानबूझ के करता, he knows that this is wrong, and he would break it intentionally. That is a very break things desire to. Anger may they will throw things away or throw things around. They would just, lot of parents say that वो टॉयज लेके बैठता है, खेलता तो नहीं है, सारा फेंकता है, फिर उठ के दूसरी जगह चला जाता है, दूसरे टॉयज निकाल लेता है. throwing things parents के साथ इनके बहुत सारे rubrics I have studied is कि वो throwing things, मतलब ये कुछ भी है, एक स्केल है, तो वो पेरेंट्स के ऊपर. आई हैव अ वीडियो ऑफ अ चाइल्ड जो ऐसे सामान फेंक फेंक के पेरेंट्स के ऊपर मार रहे हैं. सो थ्रोइंग थिंग्स पेरेंट्स एट, थ्रोइंग थिंग्स अराउंड. दे इवन थ्रो देमसेल्व्स ऑन फ्लोर, टेम्पर टैंट्रम्स, जिद की वजह से कि जमीन पे लेट जाएंगे, एंड दे आर किकिंग एंड स्क्रीमिंग एंड शाउटिंग. जो टिपिकल आपको कई बार मॉल्स में या कई बार फ्रेंड्स हु कम to your home, you see that the children falls on the floor and they are kicking and screaming and howling because they want something. So temper tantrum is also a very important feature in tuberculinum. Okay, so yeah, I have written so that we don't lose anything, otherwise jaldi mein. What is the basic philosophy of tuberculinum is to enjoy life fullest. उनको जिंदगी का मजा लेना है. उनकी वो बोलते हैं ना कि enjoy your ice cream before it melts. So that is their philosophy. They wanted to live their life, enjoy, entertain, adventure, that kind of. क्या घर पे बैठे रहते हो, या घर में कौन बैठता है. चलते हैं, घूमते हैं. You will have friends of this type who doesn't want to. So this COVID would have been horrible for them. कि they don't want to sit at one place. They cannot be restrained, and if you restrain them, they feel oppression, suffocated. That is why they have fear of tunnels, fear of narrow places. We call it claustrophobia, because they are not meant to. That is not their nature. They wanted to live life to the fullest. I have some friends like that. You must be also having, who say, यार घर में कौन बैठता है, घूमते हैं. Every Saturday, Sunday वो घूमते हैं, explore करते हैं, bike riders. Tuberculinum में there is a destination. For example, I am going to Agra or I am going to America. So we plan the travel, we get the tickets done. So there is a destination where we are supposed to reach. Traveling में, wandering में कोई destination नहीं होता, भटकना होता है. We are just wandering. क्या किया संडे को, बस भटक रहे थे. That kind of thing. So you are tuberculinum को दोनों अच्छा लगता है. Tuberculinum can take a bike, and there is one materia medica I read that they like motorbikes पे जो हवा उनके चेहरे पे आती है, open air, they're riding in a carriage, riding in a bike, desire for. So if they are feeling suffocated or not feeling well, they would probably go on a ride. और आपने देखा होगा कि कार से कुछ लोग अपना फेस बाहर निकाल के, and they experience that wind that comes to their face. Those are also tuberculinum. They like that, they enjoy that. That gives them excitement and pleasure. So okay, even sleep, they feel it is a waste of time. क्या सो रहे हो तुम 10 घंटे? When you go for traveling, there are some kind of people who feel यार रिलैक्स करने आए हैं, तो वो होटल से 10 बजे उठेंगे, फिर नाश्ता करेंगे, and then 12-1 बजे they will step out of the room. Tuberculinum is not that type. Tuberculinum बोलेगा यार घूमने आए हो तुम तो क्या. So why I am telling these versions, I can tell you direct rubrics also, but what happens is rubrics we all study, but we are not able to convert patient's language into rubric. So I am trying to tell you the various versions that you see around you, and you don't know that this is a version of tuberculinum. It becomes so easy. Then you can make it out कि आपके ग्रुप में कोई बंदा ऐसा है कि यार सुबह 6 बजे उठ के, if you go to Goa, they start, they go on a beach, or they hire a Activa and they are going on a ride. So you are wondering यार ये सुबह 5 बजे उठ के क्यों जा रहे हैं? That is that they like, So देखिए क्या सोते रहते हो. So there's a rubric activity. Sleep is waste of time. So they desire activity and they feel that जो सो रहा है 10 घंटे वो फालतू टाइम बर्बाद कर रहा है. Are you understanding? I'll be happy if you write something also so that I know that you all are also understanding what I am trying to say. One more important tip about, so I told you about traveling and how they want to enjoy life to the fullest and the constant change a adult and a child wants. Tuberculinum children have a lot of, fear and disgust and malice towards animals. They don't like animals, especially furry animals, cats and dogs. They really don't like. They can really trouble those cats and dogs. They can be malicious and vindictive towards the dog. So sometimes, when the case is going on, and in the end, you can ask these 2-3 questions, and you will never find a tuberculinum child for love for pets and love for dogs. So to just filter out the 2 drugs, then you can probably ask these questions, that whether he plays with one toy or is he fond of animals, just to clear it. So one more thing that I have told you about cuprum once in one of my videos, that they are obstinate alternating with mildness. In the same way, tuberculinum is sorry, I think the light is, the Wi-Fi is not working. I'm sorry for the disturbance. So पेरेंट्स कहते हैं बहुत मूडी है यार, मतलब कुछ कह नहीं सकते इसके बारे में. Very mild, and he understands and he behaves very nicely. So that feature is also single tuberculinum. Emotional blackmailing, says mama you don't love me. We discussed this rubric in pulsatilla कि parents बच्चों को कुछ चाहिए तो वो मम्मी को बोलते हैं कि मामा प्लीज गिव मी ना, यू डोंट लव मी और व्हाट, यू डोंट वांट मी टू बी हैप्पी. तो ये ब्लैकमेलिंग है, ये इमोशनल ब्लैकमेलिंग है. दैट tuberculinum also do, like pulsatilla. But pulsatilla and tuberculinum otherwise are poles apart. I have confused between pulsatilla and tuberculinum, but this rubric is present in both. Okay, so yeah, so they in pain, or when they can really pull their own hair, or you'll see the child pulling parents' hair sitting in the cabin, temper tantrums, pulling their own hair, pulling hair of bystanders or people near them. So there is a lot of internal restlessness and hyperactivity, but they care for their family. They have anxiety towards the family members and towards themselves also. Just one second. I just come. I'm so sorry. So there is so much care for the family and the loved ones. Tuberculinum has. Yeah, pulsatilla also has emotional blackmailing, but pulsatilla is poles apart than tuberculinum. Okay. Now, fear of tuberculinum. Tuberculinum has fear of dogs, fear of cats, fear of furred animals. Tuberculinum has fear of dark in children. They have a lot of nightmares. So नींद में बच्चे चिल्लाते हैं, हाथ पैर मारते हैं, kicking in sleep, fear of dreams. They get frightful dreams, tuberculinum. And बच्चा भी will also like traveling, Their parents will say कि इसको घूमने ले जाओ, बहुत अच्छा लगता है, कहीं भी घुमा लाओ. बाइक पे पापा, बहुत सारे बच्चे करते हैं कि when parents come home, they say कि राइड दिला के लाओ, मुझे एक चक्कर दिला के लाओ. So they say कि, they like that traveling, that wandering, motorbike ride they like. और आजकल वो cars आती हैं जिनके ऊपर, that glass is there, so they would stand there and they would enjoy that wind blowing on their face, and so they love all this. Tuberculinum also has fear of going to the doctor. The doctor terrifies the child, or they have fear of medical examination, and they have lot of fear of going to a dentist. Yes, so physical examination का fear होता है. अभी हमने fear में stramonium पढ़ा, hyoscyamus पढ़ा है कि यार ये इंजेक्शन ना लगा दे. स्ट्रेमोनियम को भी fear injury being injured का fear है. So we have to understand there are many other remedies also which to differentiate these closely enjoy life to the fullest. So they like fashion also, whatever the best brand clothes launch hue hain, they want to buy that if they can afford, depends on which class the child is coming from or the family is coming from. Or koi mobile aaya, koi naya gadget aaya, koi naya feature aaya, they want to do that. They like mountains more than beaches. They want to go on mountains. They don't like much of beaches and damp thing. They like dry, cold. No, there is no particular reason why they don't like pet animals or fur animals. This they have been seen in proving that tuberculinum child doesn't like and can be malicious and vindictive towards animals. So they want that change and their fashion, and that it excites them. So imagine a person who would like all this change and traveling. What kind of bond they will develop with people around them, their friends or their closed ones. So they don't have a lot of bondage. They are not very attached to the people around. They don't share that kind of strong bond with their friends. भटकी हैं, भटकते रहते हैं, तो यहाँ आज कल वहाँ, they'll be nice to the people with the friends, but that bondage, that closeness, that affection is lacking in tuberculinum, because they like to live life at the edge. Are you all understanding what I'm trying to say? You should have seen a lot of people. I say so. Lot of anger in children, anger sudden, anger throwing things around, anger, temper tantrums, violent anger waking on. They can be biting. I always told you how the child will enter, what the child will behave when we are talking with the child, and how the child will answer. So tuberculinum child really doesn't want to answer a lot. So how will they answer? So it is an answering monosyllables in yes or no. क्योंकि उसको टिकना ही नहीं है ना, उसको तो इधर उधर क्लिनिक पे भी चलना है, घूमना है, देखना है. Yes or no, or answering no to all questions, or monosyllable in. So you will not see tuberculinum child answering long answers sitting in the clinic. So these small. Recently, day before yesterday, I had presented a case of Baraita Kaha in a group, and different people were coming with different remedies like silica, kilkiriaka. One thing is not important. You have to join the various things and it should form that loop that you join when you take a case. It should fit the drug picture. You cannot take one symptom, answering nodding by, and give pulsatilla, or you cannot say no to all questions and give tuberculinum. Rest of the things should also match. If it doesn't match, that means you are missing something, and it is just an observation by chance. This is not the core of the child. This is not the core of the patient. So you should know that various pieces that you collect during case taking, how to match them and how to understand them so that you come to a correct remedy. कई बार ऐसा होता है कि जब हम केस लेते हैं, हम सबके साथ, हमारे साथ, आपके साथ, जब हम केस लेते हैं तो हमें लगता है कि अरे आंसरिंग नॉडिंग पल्साटिला का है, पर क्यूरियस है, साइंटिफिक तो है, सल्फर तो नहीं. तो देयर इज अ कांस्टेंट टसल इन अ माइंड कि यार क्या रेमेडी है. आपको एक सजेशन है कि आप ये ढूंढने की कोशिश मत करिए कि क्या रेमेडी है, आप ये समझने की कोशिश करिए कि पेशेंट क्या है. एंड देन बिकॉज maybe the child is moschus, or maybe the child is spongia, and I have not read much about spongia, but when we are trying to search a remedy, we search a remedy that we know. Probably I know maybe tuberculinum, veratrum, tarantula, or such remedies. But when we understand the patient and then form the core and then look for a remedy, then we'll be able to understand some things which we might not know, which we might have not studied. So understand the patient first and then jump to a remedy. Don't jump कि बच्चे ने आके 2 बार answering nodding कर दी and you gave pulsatilla. It is not so trivial. It is not so easy. It's easy, but it's easy only when you know. If you don't know, you feel it's so difficult how to form that. Okay. So it is in kicking sleep in, kicks tantrums in, pull hair one's own and others. They don't want to take medicine, so mood repulsive medicine to take medicine. देखते यार मन नहीं करता दवाई खाने का. Rage, fury, cursing with. There's a lot of rashness rash behavior. Rashness can be used in various sense, in behavior, rash decision, rash driving. So there is that kind of impulsiveness, rashness in tuberculinum. Okay, teasing, they can tease others. So we have rubrics. First I told you that they are contrary parents with. मतलब parents would say यार इसको जो बोलो ना इसको उल्टा करना होता है. Especially हमारे साथ तो उल्टा ही करता है. हम अगर बोलेंगे sometimes if we have to get the things done तो हम इसको बोलते हैं कि यार तू प्लेट अपनी मत रख कराना. हाँ, खाना खाने के बाद प्लेट मत रख देना अपनी. तो वो रख देता है. हम लोग उल्टा बोलते हैं ताकि वो काम कर दे. Lot of, if you see in your practice, lot of parents say that कि हमारे साथ तो इसका ज्यादा ही नाटक होता है. He knows how to trouble us, so जानबूझ के ये करता है. So sometimes if to get the things done we talk contrary, मतलब हम उल्टा बोलते हैं. That is the rubric contrary parents with. There's a rubric self control loss of parents with. Destructiveness intentional, destructiveness infections after. All this is in tuberculinum. जानबूझ के करते हैं, जानबूझ के, to trouble, to give hurt to others they will do. Okay. They do not like to bathe, the washing aversion to children in. There are two rubrics very interesting that I have also not used but I came across. Unconsciousness, coma, sudden. Screams, tears her hair, beating head with fist or against the wall or floor. One more, unconsciousness, coma, sudden, suing or talking with, attacks daily for a month. At the same time, tuberculinum child can be timid, bashful, mildness, quiet, emotional blackmailing. This is one. But still that restlessness, that change desire, that wanting to enjoy and wanting to live life to the fullest is the core of tuberculinum. Yeah, they can be abusive towards parents, right? Lifestyle also is very indulgent. There's no self-restraint. Some people say, we travel probably once in 3 months because we need to manage the finances, and tuberculinum is not one of them who has a lot of restraint. They want to enjoy life to the fullest, and enjoy is basically that travel, that job change, that excitement, that you should understand. So they can be very innovative because you cannot restrain them, right? तो ये आंसर लिखा है यही पढ़ना है ऐसा नहीं है. So scientists, innovators ये जो है ना वो tuberculinum हो सकते हैं. Consensuous about trifles, very proper, intelligent is also tuberculinum. So they are very discontented about everything, about surroundings basically, and then they want change. बट कुछ दिन बाद वो वहां जाके भी बोर हो जाते हैं. सपोज किसी ने जॉब चेंज किया है तो बहुत बोरिंग हो रहा है, ये मुझसे नहीं हो रहा है, मैं तो पक गया हूँ. एंड देन दे चेंज अ जॉब एंड गो टू अनदर जॉब एंड देन दे फाइंड दैट आल्सो बोरिंग. एंड सो दिस इज अ कांस्टेंट cycle with tuberculinum. For tuberculinum, self-gratification comes first. They give a damn about the surrounding. उनको कोई फर्क नहीं पड़ रहा होता, उनको रत्ती भर का फर्क नहीं पड़ रहा होता कि सोसाइटी के नॉर्म्स क्या हैं, या मेरे घर में मेरी बीवी क्या कह रही है, या ये लोग क्या कहना चाह रहे हैं. उनको कोई फर्क नहीं पड़ रहा होता है. They wanted to enjoy their life. उनकी जो इच्छा है वो पूरी होनी चाहिए. I was talking about dress and fashion, so there is a rubric dressed best at his fashionable. Dresses best at his fashionable best. They want that freedom. So this is tuberculinum. Shameless children. We have a rubric in tuberculinum. So we'll take the questions now. There's no point giving one rubrics. We all have discussed those rubrics: wandering, desire for, and very. Commonly we have discussed this rubric in detail. So you have to understand, I'll tell you a gist of tuberculinum now, कि जो एक जगह बैठ ना पाए, there's a lot of internal restlessness in child as an adult also. टिकता नहीं है ये घर पे, दिन भर भटक रहा होता है. He doesn't want to play with one toy. He wants to travel as an adult. बच्चा तो travel नहीं करेगा खुद से. Escape how to differentiate behaviorism. आप escape कब करते हो? Escape क्या होता है? You escape from a situation. You escape from a danger. Escapism कुछ problem में होता है. Desire इच्छा होती है. मुझे कोई प्रॉब्लम नहीं है मेरे घर में, बट स्टिल आई वुड लाइक टू ट्रैवल, आई वांट टू डू अ रूट, मैं बाइक से ले लद्दाख जाना चाहता हूँ, आई रियली वांट टू संडे को मैं बस ऐसे एक नो डेस्टिनेशन आई वांट टू आई ऑल्सो हैड दैट वंस कि आई वांट टू जस्ट go for a week without thinking where you have to reach, and probably the way you reach the place you reach, and then you decide some. So that is wandering, that is a desire. Escape एक situation में होता है कि यार मेरे को लग रहा है ऑपरेशन नहीं कराना है तो होम्योपैथी ले लेते हैं, ये escape है. So it is very different from escapism. That desire में इच्छा होगी, और escapism आप situation से बचने के लिए आप escape कर रहे हो. तुम can we use abusive to ones? No, we cannot use. Can we use abusive to ones who take care of child in modern world where both parents work and child has to stay with nanny most day? See, पता है, we should be non-judgmental. We should be unprejudiced. When you ask this question, you have a little negativity towards the parents who leave their children at home with the nannies. As a physician, I am no one to judge. It is not abusive. It is not, what are you trying to say? That is abusive toward the child. No. Different people have different priorities and different problems. And it is not our duty to understand whether it is right or wrong unless there is a common consensus, like beating is wrong, or hitting someone is wrong, or abuse, gali dena is wrong. We cannot take abusive over here because they are not actually abusing the child, Mood repulsive is repulsive. We say ki magnets repel each other. Repulsive, you're not in the mood, I just want to get rid of this problem. That is mood repulsive, commonly used. Thak gayi hu yaar, I just want to get rid of it. Your mood is repulsive towards it. So we use mood repulsive. Please differentiate tarantula and tuberculinum. Next session, I am planning to take tarantula or veratrum. There are a lot of things, and when we take all three drugs, then we'll talk about the differentiation. Because for that, we need to understand tarantula, uska core mischievousness hai. Tarantula spider hai, to आजू बाजू देख के शैतानी करता है. So we'll take veratrum and tarantula, and these three drugs comes very, very closely. But the core is very, very different, and then we'll probably differentiate tarantula and tuberculinum. First, I'll take veratrum, and then I'll take tarantula or whatever. I'll announce that before, and then we'll differentiate all three. Any other questions? We'll take quick questions, and then it's been already 40 minutes. Yeah. Tuberculinum children are very, very intelligent, innovators, I told you. So we can take in children who are intelligent but have behavioral problems. What I am doing nowadays is there is a rubric, is behavioral problems children in, and it has almost 37 or 38 remedies. I'm planning to study each remedy in detail because recently I'm getting a lot of children with behavioral issues, and to understand, because I also know some few remedies like moscus, tarantula, tuberculum, veratrum, and sometimes, we start feeling stuck with such cases, and so I am planning to study various other drugs also, so you can also do that. We can use higher potency. I always say that potency judgment you should know we can use, but it's always better to start with lower. Recently I'll share that case once. Recently in a case, I have given to a teenage directly 1M because it was an emergency and there was a lot of anxiety, not tuberculinum, naxomic I gave. Rarely I start with 1M, but in that case I gave 1M because she had an IIT JEE exam the next day and she was in a bad state. And I was very, very sure of naxomica and I gave 1M and she had wonderful result with 1M. So that comes with judgment. Also, which potency, but it's always nice with children to start with a little lower potency. Please describe eye kind of pain. I didn't got the question. Females of tuberculinum, females also would not like to, उनको लगेगा यार क्या रोज वही घर का काम, रूटीन अवर्जन होता है उनको, वही घर का चौका बर्तन, daily routine they don't like. They also want to explore. So every Sunday, if they get a chance, they would like to travel and do something. Potency and repetition, I rarely repeat the drugs unless it is very, very essential. So I keep them on Fitem and Satlac. I would give 30 and wait. Yes, tuberculinum is obviously a medicine that is made from tubercular nodule. If we study physical structure of tuberculinum, they are lean, slender, flat-chested females, narrow-chested and lean, thin hote hain, beautiful hair and light complexion and that kind of female. Yeah. We can use it for weight gain. Tuberculinum, ioderm both have, loses weight while eating well, but I do not give symptoms. I would not recommend rather to give only for weight gain. If that totality matches, if the mind is tubercular, you can give it to a lean child. If the mind is tubercular, you can give it to a fat child. So as I will say again and again, all the things should match, not one thing. कि भैया खा रहा है फिर भी lose कर रहा है, तो I'll give either ioderm or tuberculinum. No. I use bachelor remedies for such behavioral issues also, like vervain, impatience. Therapy, what happens is a 4-year-old child, or 6-year-old child, you cannot really counsel. But we have a counselor attached to our clinic. For adults, though, we can do directly, but in pediatric cases, what we do is we try to counsel the parents. We try to explain the parents what is going wrong. Sometimes parents are receptive. Sometimes they say, अभी रिसेंटली एक केस था, आई डोंट रिमेम्बर किस चीज़ का केस था, बट एक केस था जहाँ पेरेंट बोल रहे थे कि हम मारते हैं बच्चे को, वी हिट हिम सो बैडली, स्टिल इतना शैतान है यार. So I told him that you should not hit the child. The hitting is not probably the right method. And if it is the right method, तो अभी तक तो बदल जाना चाहिए था बच्चे को. तो सर हम तो इसके लिए भले के लिए कर रहे हैं. मैंने बोला पर भला हो नहीं रहा है ना. If you are doing for good also, then also that good is not happening. So they were very, reluctant to even understand what I'm trying to say. So some children you can counsel the parents, but in some cases it becomes difficult. But yeah, you should put your some points. Like I tell all the parents of children who have behavioral issues, who have temper issues, and they throw themselves and they are banging their head, that it is a learned response. When the first time the child bangs his head into the wall, or is throwing himself on the floor, that very time, that आपका reaction will teach the child what will be his next response. For example, जब पहली बार मेरा बच्चा या मेरी बेटी बोली कि मुझे तो चाहिए, I want a chocolate at night 10 o'clock, and she starts crying. So I said, no, it is not going to happen, because it is not the time that we can go out. And I just let her be, I just let her cry, or I just let her, take that time to sink in. And then what she realized, she may cry for half an hour, 1 hour, whatever, different upon the child. And then she learned that, this crying didn't help. But what on the other way helps happens is, for example, बच्चे ने सर मारा और आप डर गए, कि oh लग जाएगी, and you said कि okay, you take this chocolate. बच्चे ने क्या सीखा उस मोमेंट पे? बच्चे ने सीखा कि जब मैं सर मारूं, या जब मैं रोऊं चीख के, या जब मैं चिल्लाऊं, मेरा कहना मान लिया जाता है. So all this is a learned response. So I definitely tell the parents that don't make them learn the wrong things. Let them learn the right thing. And you cannot have these responses according to your own convenience. For example, today I'm taking a session and I don't want my daughter to disturb. तो मैं बोलूँगी कि खा ले, चिप्स खा ले, या टीवी देख ले 1 घंटा. एंड आज मैं फालतू हूँ और मेरे पे कोई काम नहीं है, तो आज आई एम गोइंग टू टीच माई चिल्ड्रन, एंड आई से नहीं आज नहीं खा सकती. तो बच्चा बड़ा कंफ्यूज हो जाएगा कि चाहते क्या है पेरेंट्स. सो देयर हैज टू बी अ कॉमन ग्राउंड्स एंड कॉमन रूल्स दैट यू हैव टू सेट इन योर प्रैक्टिस, इन योर हाउस. ओके, आप एक एक चीज से कभी भी डिफरेंशिएट नहीं कर सकते कि आई टोल्ड यू कि लैकिसिस और ट्यूबरकुलिनम की हाइपर एक्टिविटी कैसे डिफरेंट है. लैकिसिस कैन प्ले विद वन टॉय इफ दैट टॉय चार्म्स हिम, और ट्यूबरकुलिनम विल नेवर एवर प्ले विद वन टॉय बिकॉज देयर इज लॉट ऑफ डिफरेंट. लाइको और ट्यूबरकुलिनम में एक रूब्रिक जो कॉमन है वो है बिहेवियर प्रॉब्लम्स चिल्ड्रन इन गुड एट स्कूल बट नॉट एट होम. ऐसा एक रूब्रिक है जिसमें वी हैव डिस्कस दैट रूब्रिक इन लाइकोपोडियम व्हेन वी डिस्कस लाइकोपोडियम आल्सो, जिसमें लाइकोपोडियम ट्यूबरकुलिनम एंड थूजा है ना. तो ट्यूबरकुलिनम कम्स वेरी क्लोज दैट वे. Lycopodium are not very restless. There are other shades of lycopodium, timidity, talk in public too, or fishing aptitude for. We've discussed lycopodium. तो क्या है कि कुछ rubrics obviously common होंगे क्योंकि we are not only studying the singular rubrics, but that core of the remedy is different. Okay, I'll take bacillinum also once and we'll differentiate that. I don't prescribe them as nosode, to be honest. I prescribe them as individual in centesimal scale potencies. So I don't use mother tinctures. I hardly use specifics. I don't prescribe nosodes. Till now in these 15-16 years, obviously we all have to learn. I'm not saying you should not. You can. But my practice is basically on mind and understanding the person as a whole and forming a totality and then selecting a medicine, and it really works. We've got very good results with it. Yes, we can use tuberculinum in acutes also. I have given to 1-2 patients, not very frequently, but yes, I think there was some typical fever before. There is a rubrix fever. Before chill, they become very restless, and after infection, they become very destructive. These are singular rubrics of tuberculinum we can use, and dose depends upon the totality. You can select the dose. ये potency selection पे बहुत सारे queries हैं. We'll do one Facebook live on potency only. Any other questions? Yeah, I have one announcement to make. We have done 2 paid sessions of Zoom, and now we are coming up with 3rd session. And this time the topic of the session is approach and management of cases of migraine. Recently, I have seen a lot of it. For a change, it is not pediatric because I thought it would become monotonous. So I'll be showing, as time permits, 2 to 3 cases of migraine with different medicines. There are some very common symptoms of migraine कि यार आवाज़ अच्छी नहीं लगती, या noise अच्छी नहीं लगती, या light अच्छी नहीं लगती, या I don't wish like to talk to. One of the junior asked me, no offense to her, कि we see the man in the disease and why are you taking a topic like migraine? I'm taking a topic like migraine because first of all, it is very common in today's practice. Second, in our repertory, many of our rubrics are related to the disease also. For example, I talked about qualified mentals. For example, irritability headache or such where there is a physical ailment and a mental concomitant, fear of liver disease, or so such rubrics of headache. There are many. Or of pain. Pain is a physical symptom. It can be mental also, but pain is a physical symptom. So irritability pain during, weeping pain during, spoken averse to be during pain, or such, so when their headache is a disease or a symptom or a pain, and there are various things that can come with headache, and I study that way. I sometimes take a disease or a symptom, or there are books on pain I have read. So to understand pain and how a human reacts to that pain is also very important. So I'll show you with different remedies, migraine cases, and the approach and how I manage them with follow-ups. They are very interesting cases. So those who wish to attend, it is on next Saturday, that is 17th of October. And the timing would be again 3 to 5 because lots of people said that it is the most convenient time for them. And register fast because I'm not using a paid version of Zoom. So we have limited seats, and some, it's easier to answer the questions also. So if you want to register for it, you have to pay 200 rupees on my personal account, and all the details will be given, and the session will be on 17th of October. So thank you. We are growing. We are 2,200 or 300 now in our group. And it gives me immense pleasure to do these Facebook live sessions. Is bahane meri bhi padhai ho jati hai. And a lot of things that I have forgotten and not used. And I'm surprised how many things each time we study, though we still say कि belladonna का सब आता है, पर जब भी आप पढ़ते हो उसका कुछ नया या नया पार्ट यू पता चलता है. And so it's wonderful to study and to share my knowledge with you all, whatever I have learned in this. I come from a homeopathic background. My father is a homeopath. So I'm absolutely in love with this field and I absolutely love what I'm doing. So it feels great to be a part of this forum and discussing and learning. And thank you.